now in the month number 4 of my second hair transplant done at Vera Clinic in Istanbul, where I got 4,500 grafts transplanted, out of which 500 were extracted from my beard and the rest from the back of my head. As you might see, my hair is slightly longer than in my last video. Actually, it has this weird length where it's not short enough to buzz cut it, neither long enough to style it. So from now on, I will plan to leave it to grow for at least 1 month, and at 5-month mark we'll have a look together. How does it look? Speaking about the current results, I can say that I feel there is a bit more hair than a month ago, especially in my vertex, but there is still not, let's say, a huge difference. But anyway, I was prepared for, and this is exactly what I expected at this point in time, so no surprises here. At the end of this video, we'll have a look closer at my hair from different angles. But before that, I want to answer a question which was raised a few times in the comment section, where you asked if I'm not on Finasteride and if I am not afraid of the side effects. So the answer to this question is yes. I started to take Finasteride straight after my second hair transplant. Not straight, but actually after 1 week. And the prescription from the clinic said to take 1/4, which is 1 milligram, every day at the same time. But I slightly changed the frequency, and I am taking 1 milligram every 2 days. This is purely my own decision, and I'm not trying to convince anyone that this is better. I'm just being transparent, and I'm sharing with you what I am doing. And I think I don't need to remind you that I'm not a doctor. Yeah. So I'm just a random guy on YouTube which had 2 hair transplants, and I'm just sharing my experience on this platform. Yes. So okay, I will now play a short video where the Dr. Russell from the Hair Loss Show explains the logic behind my decision. And we'll come back shortly after the video.
5 milligram tablet that they take every day. But for the hair, the recommended dose is 1 milligram. And the reason it's recommended at 1 milligram is because if you track the response curve versus the dose curve, I know that's a bit technical, it kind of flattens off at about 1. And what that really means is that more isn't better, okay? More is not better. 1 milligram is enough. Now, where I'm going to be a little controversial with you today is talking about what the correct dosing is, because the recommended dose on the packet says 1 milligram per day, right? In other words, you're supposed to take a tablet every day. Now, I certainly think that's acceptable to do, but it is not necessary in many people for you to take 1 milligram every day. Why? Because the drug lasts a lot longer than a day in the system. If we go back to the idea that this is happening in the hair follicle, then it's not about the amount that you have in the blood that is most important, it's the amount you have in the skin tissue that's important. And a dose of finasteride lasts 30 days, minimum 30 days inside the skin. So we really, in my opinion, and I'm saying it's my opinion, don't need to take this every day. So basically what I ask my patients to do is take it probably on average about 3 times a week. Now you'd say, well, why not just take it once a month? Well, the body is continually creating new enzyme every day. So all we're doing is mopping it up. And in my experience, over 20 years using this dosing schedule, my results are the same in terms of being able to achieve stability as people who take it every day. So that is, for me, an important finding, because the other side of that argument is that the number of patients in my practice that get any side effects on finasteride is correspondingly reduced because I'm asking them to take less of it. So key point here is that most people, in my opinion, that get side effects, it's because they're taking too much of it. And that's a critical thing, because if we can adjust the dose and down to a lower dose and still get the same effect without the side effects, then this most important medication we have could be used by many more men without fear of side effects or fear of the ability of it to harm their health.
I hope now you understand why I choose to take a lower dose. If some of you have other opinion regarding this topic, please share it in the comment section. I'm really interested to know your opinion and how did it feel for you. As Dr. Russell mentioned in the video, the main reason why he is prescribing a lower dose of finasteride to his patients is to minimize the risk of any side effects. And as he stated, more it doesn't mean better in this case. So even though the statistics show that only 2% of the people experience side effects, I think it's better to try to avoid it beforehand. And speaking about the side effects, I was interested to know how many people in our community noticed side effects after using finasteride, and I did a poll where more than 200 people answered, and the result says that more than 70% of the people here didn't have any side effects. One of these 70% is me as well. I also haven't noticed any changes in my body. Everything is functioning as it was before. Yeah. So let's wrap up this video with a closer look of my hair in the direct sunlight. And I think that would be it for this one. We will see each other in the next video update in 1 month. Thanks and take care. Bye.